Pursuant to Clause 8 of Rule 20, the Chair will postpone further proceedings today on the motion to suspend the rules on which a recorded vote or the yeas and nays are ordered, or on which the vote incurs objection under Clause 6 of Rule 20. Any record vote on the postponed question will be taken later. For what purpose does the gentleman from Ohio seek recognition?
Mr. Speaker, I move to suspend the rules and pass the bill H.R. 1919, the Safeguarding America's Pharmaceuticals Act of 2013 as amended.
Without objection, the clerk will report the title of the bill.
Union Calendar number 65, H.R. 1919, a bill to amend the Federal Food, Drug, and Cosmetic Act with respect to the pharmaceutical distribution supply chain and for other purposes.
Pursuant to the rule, the gentleman from Ohio, Mr. Latta, and the gentleman from California, Mr. Waxman, each control 20 minutes. The Chair recognizes the gentleman from Ohio.
Thank you, Mr. Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous matters in the record on the bill.
Without objection.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. I rise today in support of H.R. 1919, the Safeguarding America's Pharmaceuticals Act of 2013. This legislation is the culmination of many years of hard work by legislators and stakeholders alike, and I'm honored to have introduced this legislation along with Congressman Matheson. This is an issue that was brought to my attention when I was first elected to Congress 5.5 years ago by concerned stakeholders in Ohio, and I am pleased that the legislation is being considered on the House floor today. Securing our nation's pharmaceutical supply chain is an extremely important issue, and passage of this bill will be an important step forward to protecting America's family. The pharmaceutical supply chain touches every part of the healthcare system, and it is imperative that we get the structure and segments of it connected in a safe, secure, and effective manner that provides the best protection for patients. H.R. 1919 will make improvements to the current supply chain while providing a clear path for industry stakeholders towards enhanced supply chain protections. Pharmaceutical distribution occurs nationwide, and it is estimated that within the United States there are more than 4 billion prescriptions filled each year. By replacing the current patchwork of multiple state laws with a uniform national standard, we improve safety, eliminate duplicative regulations, and create certainty for all members of the pharmaceutical supply chain. When anyone takes a prescribed medication, he or she should have a full confidence that the medication is as prescribed and will do no harm. It is of utmost importance that we implement common sense solutions to safeguard our distribution supply chain against counterfeit and adulterated drugs, as well as improve security and integrity throughout the supply chain. This legislation is an important step forward to ensure greater patient safety for all Americans. I was pleased to receive a support letter for H.R. 1919 from the United States Deputy Sheriff's Association, which also recognizes that the national system will help curb criminal activities surrounding prescription drug diversion and criminal counterfeiting. In the letter, it discusses how a national system could deter opportunists' ability to focus their efforts on differing state laws or those states that have no laws or regulations, therefore allowing for criminal infiltration. Specifically, the letter states that tracking packages destined for patients is a good defense against criminals who would profit from contaminating or stealing those medicines and put patients at risk. To protect patient safety, this bill would replace multiple state laws and create a uniform national standard for securing the pharmaceutical distribution supply chain, therefore preventing duplicative state and federal requirements. It would increase security of the supply chain by establishing tracing requirements for manufacturers, wholesale distributors, pharmacies, and repackagers based on changes in ownership. The bill also establishes a collaborative, transparent process between the Food and Drug Administration and stakeholders to study ways to even further secure the pharmaceutical supply chain. Finally, the bill puts in place a requirement for the FDA to issue proposed regulations on unit-level traceability. The timeline put forth in this bill for all of those steps is reasonable and will allow enough time for stakeholders to comply with these new national standards and ensure that through feedback from these same stakeholders that Phase 2 is done efficiently and correctly. As I stated earlier, this issue has been worked on for many years, and setting up a track and trace process is complicated. Chairman Upton, I appreciate your leadership in moving the Safeguarding America's Pharmaceuticals Act to the floor today. We made a number of changes in the Energy and Commerce Committee to improve the language of the bill as we work to create a safer pharmaceutical distribution system to protect against the threat of counterfeit drugs. This is a highly complex area, and I understand that additional changes were made to the language in the version we are considering today. Further changes are necessary to ensure that the wholesale distribution system meets the highest standards of safety and consumer protection. In order to achieve those high standards, I am committed to ensuring that language is included in a conference report brought back to the House that establishes a direct purchase pedigree for those wholesalers who only purchase pharmaceuticals directly from the manufacturers. I know you share my goal of creating the strongest supply chain system, and I look forward to working with you as we move forward. There has been much work done on this issue over the many years, and I am appreciative of all the input I have received on this bill from stakeholders and interested parties, and I again want to specifically thank Chairman Upton and Subcommittee Chairman Pitts for all of their assistance in advancing this legislation. I urge full support of my colleagues for H.R. 1919, and I thank you, and I reserve the balance of my time.
The gentleman from Ohio reserves. The chair will receive a message.
Mr. Speaker, a message from the President of the United States.
Mr. Speaker,
Mr. Secretary.
I am directed by the President of the United States to deliver to the House of Representatives a message in writing.
The gentleman from California.
Mr. Speaker, I yield myself such time as I may consume in discussing this legislation. I rise to discuss a number of concerns I have about H.R. 1919, the Safeguarding America's Pharmaceuticals Act of 2013. It's a bill designed to improve the integrity of our drug supply chain. Unfortunately, this bill falls far short of achieving that goal. Throughout last year, members on a bipartisan, bicameral basis engaged in extensive discussions on legislation to protect our drug supply. During those months of discussion last year and at the Health Subcommittee hearing this past April, we repeatedly heard loud and clear from FDA, the National Boards of Pharmacy, and many others that if we want a secure drug supply chain, we will ultimately need an electronic interoperable system that tracks each package of drugs at the unit level and that involves the entire supply chain. This kind of a system would enable us to identify illegitimate product in real time and prevent it from ending up in patients' hands. We also heard repeatedly that creating this kind of a system is doable. Unfortunately, the bill we are considering today will not create that kind of system. The bill does not require the establishment of an electronic interoperable unit-level system. By 2027, 14 years from now, FDA will be required to issue proposed regulations for such a system. But there's no requirement that these regulations ever be finalized. And if they are ever finalized, they cannot go into effect for at least 2 more years. And certainly we are looking at 2030 or beyond under this proposed legislation. And in fact, it may never be done. The bill also has a number of additional deficiencies. It fails to adequately address the potential for bad actors to introduce illegitimate product into the supply chain through supposed returns from pharmacies to wholesale distributors. In the meantime, it will prevent states from responding to particular needs they may have in regulating their wholesale distributors. And it preempts important existing state safeguards against the entry into the supply chain of unsafe and counterfeit drugs before any adequate substitute will be in place. 2 weeks ago, Mr. Speaker, the Senate Health Committee unanimously approved a bill sponsored by Senators Burr, Bennett, Harkin, and Alexander that requires the establishment of a unit-level electronic interoperable system within 10 years and is not dependent upon FDA issuing regulations. But the Senate bill still provides plenty of notice, input, and guidance for industry stakeholders. FDA is required to hold public meetings, one or more pilot projects, and to issue draft and final guidances and as-needed regulations. Because they will not be able to delay or prevent implementation of the system, stakeholders will have the incentive to work with FDA to see that the guidances and any needed regulations are developed and released. Our fundamental goal in establishing a federal system should be to prevent Americans from being harmed by counterfeit and substandard medicines. If we cannot assure the public that legislation will establish that a system will protect them and that will do so by a date certain, then, in my view, it's not worth doing. The House bill needs significant improvement as it moves forward if our goal is to enact legislation that will truly protect the American public. Mr. Speaker, I reserve the balance of our time.
The gentleman reserves the balance of his time. The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. At this time, I would yield 2 minutes and recognize the chairman of the full committee, Mr. Upton.
The gentleman from Michigan is recognized for 2 minutes.
Well, thank you, Mr. Speaker, and certainly this afternoon I rise today in strong support of H.R. 1919, the Safeguarding America's Pharmaceutical Act of 2013. I want to thank the bill's authors, including Mr. Latta, for their bipartisan leadership on this very important issue. This bill strengthens the prescription drug supply chain in order to protect American families against counterfeit drugs. The bill also would help prevent increases in drug prices, avoid additional drug shortages, and literally eliminate hundreds of millions of dollars worth of duplicative government red tape on American businesses that are harming job growth. As Mr. Latta said, supporters of the federal track and trace legislation include the U.S. Deputy Sheriff's Association and also those in the supply chain, including the National Community Pharmacists Association. According to the CBO, the bill is going to reduce the deficit by some $24 million. Last Congress, we spent a significant amount of time working on this very important issue as we successfully moved the Food and Drug Administration's Safety and Innovation Act through the legislative process and our continued efforts beyond enactment into this Congress now. And during that entire process, we also sought input from the stakeholders, like Pfizer and Perrigo in my district in Michigan, as well as our smaller pharmacies, too. This hard work allowed us to better understand the issue, and this bill reflects that understanding. The Energy and Commerce Committee, we held a legislative hearing on the bill last April. We approved the bill in both subcommittee and full committee by voice. We certainly did have a spirited debate at the committee, but we stand here united in our belief that the prescription drug supply chain has to be strengthened. We look forward to working with our Senate colleagues on H.R. 1919 on a bipartisan basis to improve the bill, including how it addresses issues related to wholesale distributors during Phase 1. And because of the hard work that has already been put in on this issue and the importance of protecting our nation's families from counterfeit drugs, I am hopeful that we can get a product to the President's desk by the August recess. I yield back my time.
The gentleman yields back.
Mr. Speaker, I reserve the balance of my time.
The gentleman reserves.
Mr.
Gentleman
Speaker,
from California.
I wish to yield 3 minutes at this time to the gentleman from Utah, Mr. Matheson, one of the original sponsors of this legislation.
The gentleman from Utah is recognized for 3 minutes.
Well, thank you, Mr. Speaker, and I thank the gentleman for yielding, and I thank Mr. Latta for his work on this issue as well. This is a bill before us today is a product of several years of collaboration. It's a really complicated issue, and it's important that you have a lot of collaboration to try to address something of this complexity. This legislation that Mr. Latta and I have introduced together it will provide what I think are important steps for the security of our prescription drug supply chain from counterfeiters and other bad actors. We've seen in recent press reports about fake drugs slipping into the supply chain, so the threat of counterfeit drugs is a growing problem in this country. In fact, when you think about it, the counterfeit drug trade may be a more lucrative opportunity than the illegal drug trade, since the United States overall spends roughly $325 billion a year on prescription drugs. This bill is an effort to try to keep those bad actors from entering the drug supply. Now, since we've had some of these problems, some states have rightly tried to take action to deal with this. What this legislation is going to do, however, is establish more of a national standard to create some certainty for everyone in the supply chain, so there's an opportunity to work effectively in a national way. Without such action, everyone in the supply chain could be forced to comply with an ever-ending patchwork of different and complex state laws, and that patchwork will force stakeholders to step up multiple state systems, and it could still open the door for bad actors to exploit security gaps through some states that may have weaker laws. This bill also establishes a collaborative process between the FDA and the industry on establishing protocols for unit-level traceability. The bill stipulates the FDA will hold regular meetings and conduct pilot programs with stakeholders to better inform the agency as to the feasibility of unit-level traceability and the process needed to achieve that goal. This is critical to ensure that the unit-level traceability regulation is achievable, does not increase prescription drug costs for consumers, and ultimately protects patients from counterfeit and adulterated prescription drug products. What we do not want to see are regulations that are not technologically achievable, ensuring a delay in implementation, as we've seen in some state circumstances. Now, there's no question that this legislation has been an effort of several years, and there's still perhaps some work to be done. And I'm hopeful that as this legislation moves through the process of the House and the Senate goes to conference, that there's some other outstanding issues that can be addressed, and we can build even greater consensus as we go to a final product that goes to the President's desk. I urge my colleagues to support this bipartisan bill. I yield back the balance of my time.
The gentleman yields back. The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from Pennsylvania, the chairman of the subcommittee, Mr. Pitts.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Mr. Speaker. Mr. Speaker, the bill before us today is important and necessary legislation to strengthen the prescription drug supply chain and to provide greater safety for our nation's patients. Safeguarding our prescription drug supply chain is important to protect against counterfeit drugs. It is necessary to help prevent increases in drug prices while also ensuring adequate supplies of much-needed prescription drugs. Equally important, H.R. 1919 includes reforms that will eliminate hundreds of millions of dollars worth of duplicative government red tape on American drug manufacturers, wholesale distributors, and pharmacies. Sadly, counterfeit prescription drugs have proven to be a lucrative business, with many of these illegal counterfeit drugs finding their way to some of our sickest patients, including those with cancer. Additionally, some states have taken draconian actions to safeguard their prescription drug supply chain, but many of these steps will force small and large businesses to implement costly and indefensible electronic systems for tracking such drugs at the unit level. After hearings in the Health Subcommittee, on the Energy and Commerce Committee, which I chair, we heard that a more feasible and practical solution to this serious problem is attainable, and those provisions are included in H.R. 1919. Mr. Speaker, by approving this legislation, we will be saving our nation's businesses millions of dollars, protecting our patients from counterfeit drugs, and securing our drug supply chain in a reasonable, common-sense way. I urge all my colleagues to support this bill and vote for H.R. 1919, and I yield back the balance of my time.
The gentleman from Pennsylvania yields back. The gentleman from California is recognized.
Mr. Speaker, I'd like to yield 3 minutes at this time to the gentleman from North Carolina to speak on this legislation, Mr. Butterworth.
The gentleman from North Carolina is recognized for 3 minutes.
Thank you. First, let me thank you, Mr. Waxman, for yielding time, and thank you for your extraordinary leadership on our committee. Let me also thank Mr. Latta and Mr. Matheson for working together to try to get this legislation to the floor today. But, Mr. Speaker, I rise in support of H.R. 1919 and urge its passage. Since the Prescription Drug Marketing Act was signed into law some 25 years ago, a patchwork of varying state pedigree laws has evolved, leaving our drug supply chain very vulnerable. Resources should focus on up-to-date and adaptable technology using global serialization standards. In the past 25 years, industry stakeholders have been unable to agree on a uniform federal solution, but today I'm happy to report that it does exist. The fact that so many members of the industry have finally come together to embrace new common-sense regulations speaks to the importance of getting this done soon. If we fail to enact drug distribution safety legislation soon, my fear is, Mr. Speaker, that we will miss the opportunity to significantly enhance patient safety for all Americans. The House bill has improved since its introduction, and while I strongly support some of the provisions in the Senate companion bill, including a date certain to reach unit-level tracking, the House bill represents a good step forward and advances the ball toward one ultimate goal. And hopefully some of these concerns can be addressed in conference. My constituents, like all of yours, deserve to know that the prescription drugs that they use to treat diabetes and high blood pressure and heart disease are not stolen, misbranded, or counterfeited. This bill and the Senate counterpart addresses the very real concerns that spurred the introduction of this legislation. While the House bill isn't everything many of us want it to be, and Mr. Waxman spoke to that earlier, I am hopeful that once the House and Senate bills move to conference, we will see a final version that will protect consumers and better protect the prescription drug supply chain. Therefore, Mr. Speaker, I urge my colleagues today in the Senate to proceed with deliberate but swift action so that we can pass a workable solution as soon as possible so as to better protect the American people. I ask my colleagues to support H.R. 1919. Thank you, Mr. Waxman. I yield back.
The gentleman from North Carolina yields back. The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from Texas, Dr. Burgess.
The chair recognizes the gentleman from Texas for 2 minutes.
I thank the gentleman for yielding. You know, the United States has the best drug supply chain in the world, but it faces attack each and every day by counterfeiters, thieves, and rogue distributors. You know, most Americans would just assume that their prescription drugs that they buy in their drugstore have been tracked rigorously from manufacturer to retail, but that assumption could not be more wrong. In fact, current law leaves a great deal of leeway for counterfeit medications to enter the market, and the punishment for those counterfeiting prescription medications is oftentimes far from adequate. From fake flu vaccines to fake cancer drugs, counterfeit medications have been manufactured and allowed to enter the supply chain, and in some cases, unfortunately, even administered to unsuspecting patients. The United States may be the most secure, but we are still at risk. I believe we have a bill before us today that is guided by the strong principles of patient safety and supply chain integrity. The bill is flexible and does not seek to overly burden states, suppliers, or small businesses. Maintaining the integrity of the United States prescription drug supply is a compelling national priority. I want to congratulate Mr. Latta and Mr. Matheson, as well as Chairman Upton and Ranking Member Dingell, for their leadership on the issue. I appreciate you allowing me to be involved in the development of this bill, and I think it's a testament to all the hard work done, including that by our committee staff, Clay Alsbach and Paul Editel, and my personal staff, J.P. Poliskevitz. I urge my colleagues to support this, and I yield back the balance of my time.
The gentleman from Texas yields back. The chair recognizes the gentleman from California.
Mr. Speaker, at this time I wish to yield 3 minutes to the gentleman from Maine, Mr. Michaud.
The chair recognizes the gentleman from Maine for 3 minutes.
Thank you, Mr. Speaker. I rise today to express opposition to H.R. 1919. Specifically, I rise to express concern with Section 8 of this bill, which allows prescription drug labeling for physicians, pharmacists, and other healthcare professionals to be provided solely by electronic means. This provision is flawed on multiple levels. First, Internet access in rural states like Maine can often be intermittent at best. In an area with low internet connectivity or reliability, healthcare providers would not automatically have the necessary information about the drugs to make sure that they are being administered and prescribed appropriately. This is even true in areas that have good internet connectivity but may have been hit by a natural disaster like Hurricane Sandy. Second, eliminating the paper labeling requirements would have repercussions for the industry that it supports. There are more than 10,000 jobs nationwide associated with the printing of this sensitive information. In Maine, the paper industry supports 7,000 workers, including hundreds in the pharmaceutical paper industry. These workers are part of an important industry that keep healthcare professionals, dispensers, and consumers informed about their drugs. Section 8 would jeopardize the jobs of more than 1,000 Mainers. Finally, legislation passed during the 112th Congress required GAO to conduct a study of the advantages and risks of electronic-only labeling of pharmaceuticals. This study is due to be released next month. Passing this legislation that preempts the finding of this study is bad policy, so I'd urge my colleagues to support informed healthcare professionals and consumers and to fight for more than 10,000 manufacturing jobs across the country. So I'd urge a no vote on H.R. 1919.
Will the gentleman yield to me?
I yield to the representative.
I thank you for yielding to me. You're raising issues that I don't think were really brought to our attention when we were considering the legislation, and I would want to look it over carefully. But I think you raise an interesting point, and as we go into the conference after this bill is passed, I want to pledge to you that I will continue to review this issue with you and others to see what the merits would be and whether this provision should continue in the bill. And I talked to Chairman Upton, who told me that he would continue to review the issue as well. And with the gentleman from Ohio, would you like me to, him to yield to you? Are you rising to that point as well?
If you yield to me?
Yeah, I'd be happy to.
Thank you, sir. As we discussed a little earlier, we'd be happy to continue discussing this with you.
I thank both gentlemen for your willingness to look at Section 8 more closely. Thank you very much. I yield back.
The gentleman's time has expired. The chair recognizes the gentleman from Ohio.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from West Virginia, Mr. McKinley.
The chair recognizes the gentleman from West Virginia for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of H.R. 1919. Let me bring attention a provision in the bill that we were just discussing about electronic distribution of prescription information for healthcare professionals and pharmacists. The industry and the FDA have been in discussions for years about eliminating the paper attached to the bottles of prescription drugs. Let me show you this. This is what we're talking about. This wad of paper on the top of a prescription bottle. It's a folded up piece of paper. It can be in 3 and 4 parts. This is not an efficient way to distribute critical information about prescription drugs. Eliminating this wad of paper would save the consumers millions of dollars in printing and shipping costs. The House committee recognized the need to allow pharmacists the option of electronic or paper copies because some rural pharmacies may not have internet capabilities. Unfortunately, this labeling provision is not in the Senate bill. So as the process moves forward into conference, this labeling provision needs to be retained so that we have a final product that assures patient safety and provides uniform national standards to strengthen the national drug supply chain. I urge my colleagues to support this bill and the labeling provision. I yield back my time. Thank you.
The gentleman from West Virginia yields. The gentleman from California is recognized.
Mr. Speaker, I'd like to submit for the record 3 letters from the California State Board of Pharmacy and 4 letters from dozens of organizations representing consumers, patients, physicians, researchers, and public health advocates. These letters raise serious concerns with H.R. 1919, the track and trace legislation before us today, and I'd like to read a few sentences from just one of the letters. We're concerned, quote, "We are concerned that legislation as currently written does not contain the minimum safeguards to keep unsafe medicines from reaching patients. The subcommittee's proposal does not create a clear path forward to a meaningful unit-level traceability system. Furthermore, the proposed legislation would eliminate all existing state drug pedigree laws which provide essential patient safety protections as well as major tools for law enforcement. The bill would leave the U.S. pharmaceutical supply unprotected for a full 2 years before introducing even limited traceability requirements," end quote. I urge my colleagues on both sides of the aisle to read these letters carefully. They provide a detailed critique of the legislation and offer suggestions on how to fix it. And I hope we can approve this bill as it moves forward through the legislative process. So I would like to submit for the record several letters that I have discussed.
Without objection.
And I'd like to ask the gentleman from Ohio how many speakers he has.
We have none.
Well then, Mr. Chairman, I yield back the balance of our time.
Okay. The gentleman from California yields back the balance of his time. The chair recognizes the gentleman from Ohio.
Mr. Speaker, we have no further speakers, and I yield back the balance of my time and ask for support for the bill.
The gentleman yields back. The question is, will the House suspend the rules and pass the bill H.R. 1919 as amended? Those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed. And without objection, the motion to reconsider is laid on the table. Same thing. Who am I? Purpose, does the gentleman from Ohio seek recognition?
Mr. Speaker, I move to suspend the rules and pass the bill Senate 622, the Animal Drug and Animal Generic Drug User Fee Reauthorization Act of 2013.
The clerk will report the title of the bill.
Senate 622, an act to amend the Federal Food, Drug, and Cosmetic Act to reauthorize user fee programs relating to new animal drugs and generic new animal drugs.
Pursuant to the rule, the gentleman from Ohio, Mr. Latta, and the gentleman from California, Mr. Waxman, each will control 20 minutes. The chair recognizes the gentleman from Ohio.
Thank you, Mr. Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend the remarks and insert extraneous matters in the record on the bill.
Without objection.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. I rise today in support of S-622, the Animal Drug and Animal Generic Drug User Fee Reauthorization of 2013. The Energy and Commerce Committee passed H.R. 1407, a nearly identical bill, through the committee last month with broad bipartisan support. The agriculture industry, animal drug manufacturers, veterinarians, pet owners, and the Food and Drug Administration have all found both the animal drug user fee and animal generic drug user fee to be very effective and have asked Congress to reauthorize the programs as soon as possible. In addition, there is strong bipartisan support for the programs, which I think is a reflection of their success and effectiveness. Passing S-622 is extremely important for our nation. First, having quality and safe medications is essential for ensuring the safety of our nation's food supply chain. Second, these programs help livestock producers, poultry producers, and veterinarians keep their animals healthy. Third, these programs enable families to have safe and affordable drugs for their pets so they can live longer and healthier lives. It is essential that the House passes this bill swiftly so we can guarantee that these programs continue without interruption. I would like to thank my colleagues, Mr. Shimkus and Mr. Gardner, for their hard work on this very important piece of legislation. It is no small feat to move legislation to the President's desk in such an efficient manner. I'd also like to thank our colleagues in the Senate, including Senators Harkin and Senator Alexander, for their leadership. Mr. Speaker, I support this bill and encourage my colleagues to do the same, and I reserve the balance of my time.
The gentleman reserves. The chair recognizes the gentleman from California.
Mr. Speaker, I rise in support of H.R. 1407, the Animal Drug User Fee Amendments of 2013. FDA's animal drug user fee programs have been successful at speeding both brand and generic drugs for animals to the market, and that's important. However, I regret that we have not taken this opportunity to provide FDA with new tools to address a glaring public health crisis, the problem of antibiotic resistance. Antibiotics are truly a life-saving gift. Unfortunately, the more they are used, the less they work. Untold numbers of Americans die or are infected each year by antibiotic resistant bugs. We know that most antibiotic use occurs on the farm, and much of this issue is not to treat sick animals, but most of the use is for disease prevention or growth promotion. If it's for treating sick animals, no one could quarrel with that. Unfortunately, if it's used for growth promotion or disease prevention, that is a misuse of it and could lead to antibiotic-resistant bugs. We don't know exactly how much is for which of these two uses of the drug. That's why we need to ask industry to give us more data on how these drugs are being used and to take steps to curtail the inappropriate use in animals of important human antibiotics. My bill, the Delivering Antibiotic Transparency in Animals or DATA Act, would enhance the information FDA gets about how these drugs are used. Representative Slaughter has a bill, which I have co-sponsored, the Preservation of Antibiotics for Medical Treatment Act, or PAMTA, and that would curtail the inappropriate use in animals of important human antibiotics. We need to ensure that FDA not only has the resources and procedures for speeding safe and effective animal drugs to market, but also the information and tools to ensure that they are being used judiciously. I regret that we're not taking this opportunity to give FDA these tools, but I hope we will soon have an opportunity to move these bills forward. Mr. Speaker, I would like to reserve the balance of my time and ask unanimous consent that the control of the time on our side of the aisle be given to Mr. Butterworth from the state of North Carolina. Butterfield.
The gentleman from North Carolina will control the time.
Thank you, Mr. Waxman. All right.
Chair recognizes the gentleman from Ohio.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from Michigan, Chairman Upton, the chairman of the full committee.
The gentleman yields. The gentleman from Ohio is recognized. Michigan.
Michigan. Beat the Buckeye State. Thank you, Mr. Speaker. I rise today in strong support of S-622, the Animal Drug and Animal Generic Drug User Fee Reauthorization Act of 2013. This bipartisan bill is nearly identical to H.R. 1407, which we favorably reported out of the Energy and Commerce Committee last month. This bill, as well as the Animal Generic Drug User Fee Act, have proven to be very successful, and they are so important for the nation's public health. Congress first created ADUFA back in 2003 and AgDUFA in 2008. Collectively, these programs have yielded many benefits for the American public. These two bills have ensured that veterinarians, livestock and poultry producers, pet owners have access to new and affordable animal drugs to keep their animals healthy. They have assisted animal drug producers by fostering a stable and predictable FDA review process, a rigorous process that helps expedite access to new therapies and fosters new drug development. The programs also have helped American consumers by keeping the food supply safe. Having medications that keep our animals healthy is essential to keeping our nation's food supply safe. For companies like Zoetis, which employs some 700 people in southwest Michigan, these programs are vital in allowing them to keep productive, innovative drugs for pets and livestock. I was the lead sponsor of the original ADUFA legislation back in 2003, and it is terrific to see how successful it has been and how many Americans it has helped over the last decade. So I want to thank my colleagues, particularly Mr. Shimkus and Mr. Gardner, for their real leadership on this important issue. They deserve tremendous credit as we work to get this bill to the President's desk. So I urge my colleagues to support it. Yield back the balance of my time.
The gentleman from Michigan yields back. The gentleman from North Carolina is recognized.
Mr. Speaker, this time I will yield to the gentlelady from New York, Ms. Slaughter, such time as she may consume.
The gentleman yields. The gentlewoman from New York is recognized.
Thank you, Mr. Speaker, and I thank my friend for yielding. Mr. Speaker, just today, the New York Times reported that we are simultaneously facing a shortage of effective antibiotics and the growing threat of antibiotic-resistant bacteria. Already, antibiotic-resistant disease claims 70,000 American lives each year. According to today's story, Dr. Janet Woodcock, the director of the Center for Drug Evaluation and Research at the Food and Drug Administration, has warned that, quote, "It's bad now, and the infectious disease docs are frantic. But what is worse is the thought of where we will be in 5 to 10 years from now." They are even desperate enough to ask GlaxoSmithKline, working on some new antibiotics, to allow the use of them untested. The FDA is considering this to try, in a vain attempt, perhaps will turn out to be, to save people who are dying from infections that we can no longer cure. GlaxoSmithKline has said that the new antibiotics they're working on, they will not license it for livestock feed. 80% of the antibiotics produced in the United States of America is fed in livestock every day in their feed, 80%. The major reason for the increase in the antibiotic-resistant bacteria is that routine overuse of antibiotics in the nation's livestock. These are not sick livestock, Mr. Speaker. This is simply in their feed because they grow faster and they're fatter. They can get to market a little quicker. This irresponsible practice has already been scientifically linked to the growth of superbugs. It's clear, and has been clear for quite a while, that the federal government must act to end this dangerous practice. Yet incomprehensibly for more than 35 years, the United States Food and Drug Administration has refused to follow its own advice to ban the routine use of antibiotics in agriculture, not just use it for sick animals. Instead, they have proposed voluntary guidance that naively asks the industry to put the public welfare before private profits, something the industry has repeatedly shown in 35 years that they will not do. And if such dereliction of duty were not enough, the FDA has now panicked about the superbug threat that they helped to create. But instead of finally removing routine antibiotic use from livestock production, the FDA is thinking of waiving important drug testing procedures, as I said, to rush new drugs to market. The testing procedures that are currently in place are in place for a reason. Waiving these requirements is a dangerous precedent, and one that is only being considered because the FDA is panicked and has refused to challenge the special interests that helped to create the superbug threat in the first place. As the only legislator in Congress with a background in microbiology, I can assure you we will never win the arms race against nature. As long as we allow the irresponsible use of antibiotics in our society, nature will always evolve to create stronger bacteria. With 80%, as I said, of all the antibiotics going to agriculture use, our answer has to start on the farm. We have to end the unnecessary use of antibiotics on healthy animals before it's too late, and indeed it may almost be too late. At the very least, today, ADUFA's legislation should include language to collect important data on antibiotics. That provision would at least allow us to finally learn the full scope of the problem that we confront. Even more importantly, I urge my colleagues to support my legislation, H.R. 1150, the Preservation of Antibiotics for Medical Treatment Act, which would ban the routine use of 8 important classes of antibiotics in livestock, but still allow a sick animal to be treated, and to help to curb the growing threat of superbugs. We are literally standing today on the brink of a public health crisis as the food industrial complex fritters away one of the most important advances in medical history, the beginning of the use of antibiotics to cure human beings. Already, some strains of tuberculosis have evolved that are incurable, and others are coming. And some experts have said that if we don't do something soon, and as I said, it may already be too late, that strep throat could become a fatal illness, and that's what they're worried about, what happening here in 5 years. I urge my colleagues to oppose this legislation today, and please to join me in the fight to protect the antibiotics for human health. It is so important. I cannot vote for this bill, although I can recognize that some work has gone into it, but I have spent years on this, and the years are running out, and the time is short. I yield back the balance of my time.
The gentlewoman from New York yields back. The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from Pennsylvania, the chairman of the subcommittee, Mr. Pitts.
The gentleman yields back. The chair recognizes the gentleman from Pennsylvania for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of the reauthorization of 2 successful programs, the Animal Drug User Fee Act, ADUFA, and the Animal Generic Drug User Fee Act, AGDUFA. The bill we have before us today originated in the Senate and was approved by unanimous consent on May 8, 2013, and I urge my colleagues in the House to support this legislation as well. In 2003, the first ADUFA was authorized to help the Food and Drug Administration's review of animal drugs. Similar to the prescription drug user fee for human drugs, under ADUFA, FDA collected funds to help expedite the new animal drug approval process and to reduce application backlog and improve communications with drug sponsors. The program was authorized for 5 years, and Congress renewed the program for an additional 5 years in ADUFA II in 2008. In 2012, FDA completed 747 ADUFA reviews, and according to FDA, the agency has exceeded all performance goals outlined in ADUFA 1 and 2. However, absent congressional action, FDA's ability to collect these user fees will expire September 30, 2013. AGDUFA 1, ADUFA's generic cousin, was first authorized in 2008 for 5 years in order to improve the review of abbreviated new animal drug applications, eliminate application backlogs, and reduce review times. To date, according to FDA, the agency has exceeded all performance goals but one from AGDUFA 1. This program also expires September 30, 2013, unless it is reauthorized, and FDA and industry have negotiated an agreement for AGDUFA 2. These programs are extremely important, not only for our animals and livestock on our farms and ranches, but for our pets' health and well-being as well. I want to thank my colleagues, Representative John Shimkus and Representative Cory Gardner, for their outstanding work on this legislation, and I urge my colleagues to support this important legislation and yield back.
Gentleman from Pennsylvania yields back. The gentleman from North Carolina is recognized.
Mr. Latta, do you have any additional witnesses?
We have one.
All right, I will reserve our time. Yes.
The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the gentleman from Colorado, Mr. Gardner.
The gentleman yields. The chair recognizes the gentleman from Colorado for 2 minutes.
Thank you, Mr. Speaker. I thank the gentleman for yielding time. I rise today in support of Senate Bill 622, the Animal Drug and Animal Generic Drug User Fee Reauthorization Act of 2013. This legislation will reauthorize 2 very important programs at the Food and Drug Administration that will provide farmers, ranchers, pet owners, and veterinarians with speedy access to medications that they need for the treatment of herds and pets. I would like to thank Senator Harkin for leading its passage in the U.S. Senate, and I'd also like to thank Congressman Shimkus for his leadership with the House version of H.R. 1407. These programs have been a success story at the FDA. And this legislation will ensure that drug approvals are done efficiently and to the highest quality standards. ADUFA and AGDUFA expire at the start of September, and we need to pass this reauthorization today to assure there is no delay for animal caretakers and livestock producers. This bill will also help companies that develop and manufacture animal drugs by providing predictable timelines. It will also help them to benefit from a more stable review process so they can make decisions about where to invest research dollars. Colorado has a thriving livestock industry which supports rural communities and economic strength for the entire state. I said this during the committee markup of H.R. 1407. There is more livestock in my district than people, or at least that's what I'm told. Colorado is also home to one of the nation's premier schools of veterinary medicine at Colorado State University. Keeping livestock animals healthy in particular is crucial to ensuring our own health, and not to mention the health of our family pets. The ADUFA and AgDUFA program keeps our food healthy and safe while the application of animal drugs pose no risk to human health. I had the honor of introducing with bipartisan support H.R. 1408, the Animal Generic Drug User Fee Act, or AgDUFA. The bill was later incorporated into H.R. 1407. This program at FDA has achieved noteworthy success since first being authorized in 2008. FDA has decreased a backlog of applications and reduced the review time for new generic drug applications. The reauthorization of this program will continue this success and allow our animal caretakers and livestock producers to utilize cost savings associated with generic medications. I thank the Chairman and yield back my time.
Gentleman's time has expired. The Chair recognizes the gentleman from North Carolina.
Thank you. Any further speakers on my friend's side?
None.
We have none either. I yield back, Mr. Speaker.
Gentleman from North Carolina yields back. The Chair recognizes the gentleman from Ohio.
Mr. Speaker, I yield back the balance of my time and ask for passage.
The gentleman yields back. The question is, will the House suspend the rules and pass Senate 622? Those in favor say aye. Those opposed, no. In the opinion of the Chair, two-thirds being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid on the table.
Mr. Speaker?
The gentleman is recognized.
I call for the yeas and nays.
The yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted. A sufficient number having risen, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this motion will be postponed. Okay. Is she here? For what purpose does the gentleman from Virginia seek recognition?
Mr. Speaker, I move to suspend the rules and pass H.R. 126.
The clerk will report the title of the bill.
Union Calendar Number 53, H.R. 126, a bill to direct the Secretary of the Interior to enter into an agreement to provide for management of the free-roaming wild horses in and around the Currituck National Wildlife Refuge.
Pursuant to the rule, the gentleman from Virginia, Mr. Whitman, and the gentlewoman from California, Ms. Napolitano, each will control 20 minutes. The Chair recognizes the gentleman from Virginia.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and include extraneous materials on the bill under consideration.
Without objection.
Mr. Speaker, in 2007, the state of North Carolina, the county of Currituck, the Corolla Wild Horse Fund, and the U.S. Fish and Wildlife Service signed a comprehensive wild horse management plan for the colonial Spanish Mustangs that live on the 7,500 acres of private and public lands in North Carolina. This plan expired last year, and the U.S. Fish and Wildlife Service has indicated that it will not sign a new agreement. H.R. 126, authored by Congressman Walter B. Jones, requires the Secretary of the Interior to enter into a new agreement within 180 days of enactment. It will also cap the number of horses to no more than 130, allow the introduction of a small number of Shackelford Bank horses to improve genetic diversity, and will ensure that the Corolla Wild Horse Fund, which is a volunteer organization, will continue to pay for the cost of caring for and managing these horses in the future. These horses are living symbols of our colonial history. H.R. 126, which is a similar bill to one that passed the House by a voice vote last year, will ensure their survival at no cost to the taxpayers. I urge adoption of the measure and compliment the author for his tireless leadership and his passion for this issue, and reserve the balance of my time.
The gentleman reserves. The Chair recognizes the gentlewoman from California.
Thank you, Mr. Speaker. I ask unanimous consent to revise and extend my remarks.
Without objection.
I yield myself such time as I may consume.
The woman is recognized.
Mr. Speaker, H.R. 126 directs the Secretary of the Interior to enter into an agreement with the Corolla Wild Horse Fund, as well as local and state authorities, to provide for the management of the wild horses in and around the Currituck National Wildlife Refuge. It's a little hard to pronounce. The agreement will increase the cap on the herd size and specify that the privately funded Corolla Wild Horse Fund will cover the cost of managing the herd. This refuge was established in 1984 to preserve and protect the native coastal barrier ecosystem. The refuge provides habitat for migrating waterfowl and for the endangered species such as piping plover and sea turtles. It is unusual to protect a non-native species such as these horses in a wildlife refuge. Extra effort and resources are needed to ensure that the herd does not impair the ecosystem for the native animals and plants. H.R. 126 is an imperfect solution, though a solution, to a very difficult problem. We must continue working with Fish and Wildlife Service and with the local community to achieve balance between the needs of the refuge and these wild horses. I thank the gentleman, and I reserve the balance of my time.
The gentlewoman reserves. The chair recognizes the gentleman from Virginia.
Mr. Speaker, I yield as much time as he may consume to the gentleman from North Carolina, Mr. Jones.
Gentleman yields. The chair recognizes the gentleman from North Carolina.
Mr. Speaker, thank you very much, and I want to thank the chairman and the ranking member for their words today, and I'll take just a very few minutes. Mr. Speaker, as been said by both, this is a plan to maintain and protect part of North Carolina's history. As Mr. Whitman said, these horses have been traced back by genetic experts to the Spanish Mustangs that swam ashore in the 1600s.